Pharmacy industry. Hello, hello, hello. Missed you. It's been a fast week. I feel like we just started this. Just was the very first one of the RxFusion.live was last Friday. And Ken, you came back. I must be doing something right for you to be back.
I'm a fungus. You can't get rid of me. And I love it because this fungus grows in a good way. And I am glad to be back. And it was a fast week. Every day seems to go into the next. And that's a good thing because a fast paced world is a good paced world for me anyway.
Absolutely. Absolutely. If you are on with us today, I want to thank you for joining RxFusion.live. This is the pharmacy industry's first internet radio live station that we're going to do every week after week. And we're not the first, actually. I think we're the first in the pharmacy podcast nation specifically like this. But Ken Sternfeld has a show. I think is it 3 p.m. on Fridays?
Yeah, we went. You moved me over there about a year and a half ago. Oh, it was 2 years. Excuse me. 2 years ago was August, and it's the Concierge Pharmacist Show because that's what I was all about. But the world is changing, even growing with the pandemic. So you bring this up, and we didn't even discuss this, but I'm there 3 o'clock Eastern Standard Time, and we're broadcast on two channels: the Pharmacy Podcast Network channel, which is channel 3 on heliumradio.com. But you can also go to channel 4, which is Care One Concierge, which is the new pandemic. Let's get together and thrive in the new world channel. We're welcoming the Pharmacy Podcast Network Nation to listen on that channel as well, Todd. So thank you for mentioning that.
You know what? I think the listeners need to know, if you haven't tuned in before to the Pharmacy Podcast Network, you can find all of our 30-something podcast out there at pharmacypodcast.com/shows. We have so many different focuses about pharmacists, about senior care, specialty. The National Association of Specialty Pharmacies does their specialty pharmacies focus show, and we're going to actually be bringing new people on about pharmacogenomics and politics and long-term care and geriatric care. So this show that you're all listening to right now, thank you for being here, is our live environment where we want to speak to you, the pharmacists. We want you to participate in conversations that continue to build out the focus of where pharmacists need to be paying attention, and then also advocates for better patient care through pharmacy and pharmacist-related services. So that's kind of the gist of this show, Ken. But we're going to go in a very wide topics. Today's topic is on diabetes, but before we talk about that, I do want to give some reference back to Mr. Ken Sternfeld as my co-host. He does truly care. You see this funny, is that a moose on the chair?
Actually, that was developed for me by one of our API students, Anna Liang, who took a rotation early on from University of Buffalo. And she said to me, I've never met someone who cares as much as you do about our profession, and most importantly, about our students and what we're challenged with. And this is I get nice cards and a lot of nice things, mugs and things. But she brought this into the office of Dr. Michael Goodman at the end of her rotation, and she gave it to me. And it really touched my heart. It really did. And I do care. This profession is a great profession, Todd. You're not a pharmacist, but you're the number one fan for the pharmacist in our profession. And I'd like to kind of think that maybe I could be 1A, 1B, or 2 or 6 or 12. It doesn't matter what the number is. But I do care. And I care about where we are right now and the challenges we have. And we want to just be positive so that pharmacists can thrive in the new pandemic world, because everybody needs a pharmacist. Your daughter said that one time on a podcast that I did with her on a Saturday morning, and she came up with it, and I said, Rach, you are right on. Everybody needs a pharmacist.
That's funny you mentioned that. Rachel has been on the podcast now, I think 4 times, and she's so proud of that. And she always brings that up and wants to talk with you more. And she's very open-minded, so she gets things. And we were asking her about the impact on mental health for kids her age, and she's 11. So she really gave some amazing testimony from a kid's perspective of how she feels about this whole pandemic and not being able to go to school and see her friends. And it's something that when I run 98 miles per hour, as I do, it's hard for me to remember the viewpoint of a child.
Well, they're not children. They're the next generation of people who this is their world. And if we listen, God gave us 2 ears. And it's about something old, which is us. We've all been experienced, but something new. And those new ideas never more needed than in the pandemic world. So when you listen, God gave us, as I said, 2 ears. So much comes out of these young, bright, forward-thinking individuals, no matter what age they are. We need to listen. And that's also one of the things that I love to do and build things off that.
Yep. So I want to talk about the week. Let's talk about what's happening in the pharmacy podcast network land, which really is about the pharmacy industry. And before I do, if you are listening in live and you'd like to participate in at any time, just either raise your hand or tweet us, hashtag RxFusion on Twitter. If you want to mark us on Instagram, we're paying attention to that. So social media we're using today live is Twitter and Instagram. And that's all I have the capabilities of doing, as I only have 2 hands. But today I want to talk about a new show that's come to the network because I want to give a shout out to Cal Vandergrift and Shane Garrettson. Cal and Shane are students at High Point University in North Carolina, known as HPU, Fred Wilson School of Pharmacy. And these 2 dynamic pharmacy students have built themselves an amazing podcast called Let's Pharmonize. They branded this all by themselves, Ken. They came up with the format. It's almost a comedic review of clinical information, and it's really for the nerdy pharmacist and you, Ken, more so, me, the non-pharmacist. But if you are a pharmacy technician or a pharmacist and you want to listen to an extremely snarky, funny podcast, they have their Halloween episode that they just released. And these kids, you got to meet them, Ken. They are just dynamic.
Hook me up, bro, because my kids tell me, not only my students, but they go, Dad, really? I like to think that I have a kind of an upbeat and a humor type to me, but sometimes hearing it from the next generation when you tell a joke, listen, we go back, to see some of the great human people in comedy. I just bought the Time in Life or whatever, Saturday Night Live, so all the great people who came out of that. I'd love to meet these young, forward-thinking, interesting, comedic individuals anytime because I love a good laugh and I love to, kind of create a new laugh. While you're showing my picture, a call out for Queensboro, bro. You sent me a beautiful top, a pharmacy podcast top, and even in my big body, it fits nicely and smoothly. It's cool. It breathes. And again, I always rock my pharmacy podcast coffee mug, which you sent me about 4 years ago. It's got a little chip right over here. I don't know if you can see it, but for now, it serves the purpose. So what are you wearing? Drinkcoffee.com? What's that about?
New one. Yeah, this shirt I have on is from a coffee roaster in Miami known as Drink RX Coffee. And their brand wasn't even about pharmacy directly. It was about, looking at a different prescription in life being driven by exercise, because the guy who started this is, he's a huge advocate of physical fitness. But I love this shirt. This is one of my most favorite Pharmacy Friday shirts. And speaking of Pharmacy Fridays, Ken, we got to play the Pharmacy Friday song because it is, in fact, Pharmacy Friday. So here we go.
What would we do without pharmacists?
What would we do?
Working hard and saving lives. Checking the meds, immunize, it's not that hard to realize. We owe a big thanks to our pharmacist friends. Antihistamines make you sleepy. Methamphetamine make you hyper. Benzodiazepines relax you. It's all on Pharmacy Friday. It's all on Pharmacy Friday.
I promise, Ken, that you won't have to listen to that every Friday, but I'll
Oh,
push.
come on. That's Billboard. That's Billboard, top 100. When you and I talked about, you said this to me later this week, I was laughing because, music, I don't know if many people know, I was a music major. I went to Queens College for 2 years and I played the trombone. And music is really important to me on a serious note because it really uplifts you in every way. I don't know if that's song, perhaps, but one of the things you and I talked about this week is our vision, our wish for what we want this show to be, because we're really about saving lives. Pharmacists save lives. And
Yep.
we want to, the Fusion.live is really to save lives, not just of our patients, but to enhance the lives of the pharmacists who are needed to take care of those patients. So I sent you a song that I danced to at my daughter's wedding about 6 years ago. And it was from Rascal Flatts. We can't play it because they'll lock us up. But anyone who wants to listen, it's my wish. It was my wish for my family and my daughter that night that she became a Mrs. Lerner from Miss Sternfeld, and to start the next chapter of her life. And listen to that song as you do. And I sent it to people who are struggling through difficult times. And it really is an uplifting song because the wish is that you can get all your dreams and you cannot have the burdens of life, be outweighing those positive things. And this during a year when we have a pandemic, I think our wish, Todd, for the Fusion RX Live is that we do make a positive impact on the lives of every pharmacist out there who takes the time to listen to us.
Absolutely. I agree. And I appreciate you sharing that story because I think it gives relevance to the fact that we run as fast as we do with a mission on our heart, and we overlook the human side of ourselves. I constantly find myself working too much and can't wait to the next day because I want to work, and I overlook family time sometimes, to be honest. And we took some time off yesterday to go get a new puppy for my 8-year-old Lola, and Rachel, who was also very fond of our corgi Lucy, who died just last week. She had a major seizure and she passed away. So that was a big smack in the gut for our family. But the life moves on, and something that Lola told me this morning is she said, "Daddy, I love my new puppy Gracie." We called her Gracie. And I know she'll never take place of Lucy, but love is about life. And I was like, wow. I was like, you're 8 years old and you said love is about life. So that's pretty amazing.
Well, family first, but that those pets are your family. And again, I have a very dear friend who also just lost her dog, and she flew home to her family across the country because you need to be close to family when things occur that create the depression and the anxieties, et cetera, that we're all living through. But it is, through one life lost, then there's another life that comes about. And your daughter, of course. And I get to share that and hear that because you share some of that family time on social media. You're not just saving the world of pharmacy 24/7. You do post a lot of your personal things about when you go out with the girls and you do the things that are really family focused. And I appreciate that. And I like to do the same thing. And Pharmacy Friday for me starts with my granddaughters on Frozen Pharmacy Friday when I watch the movie with them, like I did at 8:00 this morning.
Right. It's funny how much you have to watch kids programming too, because it's just over and over and over again. We're coming up on our first 15-minute segment, and promised to many of our sponsors. We want to definitely talk about them. I do want to talk about CE Impact real quick. They just did a new episode that is out, and they do one every Tuesday. And their latest episode was titled "The 3,000-Year-Old Miracle Drug," and it's about LoDoCo2. I don't know how you say LoDoCo2 trial, and they referenced from their host, who is Dr. Jeff Wall. He's a professor of pharmacy practice at Drake University, and he's the host of Game Changers podcast, which is CE Impact's podcast. Ken, what is this drug that's a 3,000-year-old drug?
Well, I can relate to Mel Brooks, who was the 2013-year-old man who would talk about life as it was. And I'll be honest with you, Todd, from a clinical perspective, I have no idea what that drug is. But what I can tell you is, because you'll always get an honest answer from me, I tell our students, if you don't know the answer, just say, I don't know, but let me see if I can get back to you. Because the worst thing you can do is try and fudge your way through something.
Yes.
But I have no idea what that drug is.
So if you're with us and you're on Twitter and you can do hashtag RxFusion to join the conversation, please do so and let us know what this drug is all about. I did listen to the episode, but I listen differently than pharmacists do. I listen for editing purposes and not for content consumption purposes. Although I can't believe how much I've learned about disease states in pharmacists, especially pharmacogenomics, just in listening to people like yourself, Ken.
Well, don't listen to me about this drug because I'll probably send you down the wrong path. However, every drug is out there for a reason. But more importantly, and I feel this from my heart, is the ability to not just tell that individual what that drug is, but to advise them. And I could talk to a patient tomorrow, today, this afternoon, to advise them that this drug was prescribed for you by your doctor, and there's certain things that really can only be accomplished if you do it, if you take it the way it was prescribed. If there are side effects, let us talk to you about how to deal with that. So putting a pharmacist into the vial, putting that pharmacist next to that conversation is what a concierge approach is. Because there's nobody on earth, not even Alexa, who would tell you everything you need to know. What the patient needs to know and hear is that you care and that you're there to help them and answer that question.
Exactly. CE Impact has been a sponsor of the Pharmacy Podcast Network for about a year now, and they're just an amazing organization led by Jennifer Moulton and Suzanne Feely, both PharmDs, and we love what they're doing. They're an incredible group. Online education in CE, continuing education the way that you want it, when you want it. Look at them, ceimpact.com. Once again, that's CE Impact. C is in continuing, E is in education, impact.com. But I want to get them on the show with us, Ken. They might be scheduling in next week, but we do have confirmation for next week, which is going to be Dr. Lisa Faust. Dr. Lisa Faust is a very aggressive and knowledgeable pharmacist, more so in the business of pharmacy. And she was the chief operating officer at Pharmacy Development Services, PDS, for some time. And she has now joined the team with Wellgistics, which is a generics company. So we're going to hear from Lisa next week.
I know of Lisa, never had the pleasure to speak with her, look forward to it. PDS has always advanced initiatives for adding clinical services and business development for independent pharmacies. And Lisa, I look forward to that business development, because pharmacy is about the profession of pharmacy, but it's also about the business. And fusing those two things together is what I've always tried to do, because you can't do one without the other.
Exactly. Hey, thanks. And shout out to Pharmacy Marketing Simplified. They do a podcast for us ongoing. They have a tremendous amount of great content. This is a team of pharmacy marketers called GRX Marketing, led by Nicole McClure. And Nicole and team focus on community and independent pharmacy marketing. The reason is because Nicole's a part owner of about 9 pharmacies out in the Midwest. And she did some block and tackle proving of how pharmacists can use social media and different things that were very popular, say 10 to 12 years ago. And now it makes sense. But they released an episode called Educational Marketing During Flu Season, and how important it is to, through education, telling your patients about this coming up flu season, especially now, Ken, with COVID-19, because there's more worried people, parents, and children of seniors that are taking care of their mom and dad, that are more worried about flu this year than really ever before.
Well, the word vaccination has come into the forefront, and if you know and think about any, there's a shortage right now, even early on in the season. And back to Nicole, I know Nicole, there's someone who I have spoken to. And again, we were early on in our development as a company with RxVIP, and Nicole had great marketing initiatives and website design and social media. And I'll be honest with you, I wasn't ready for that. We were building out the evolution of RxVIP, but I love what Nicole is doing, and the fact that she has those stores, she could talk from experience. And we would love to, I hope to invite her on, because you need the perspective of the independent pharmacy owner right now, so that those others who listen to you can see that there is a light at the end of the tunnel. You're not going to beat PBM reform, and you're not going to change it overnight, but there are clinical services and value-based initiatives that any independent pharmacy can bring in today. And those are kind of the things that I'd love to share with Nicole.
Exactly. All right, we're going to take a quick break. Hey, Pharmacy Podcast Nation, you got to listen in every Tuesday to stay up to date on the most recent medication therapy topics. Game Changers creates awareness about pharmacotherapy and clinical practice changes that can significantly impact pharmacy practice. Every Tuesday, a new episode of Game Changers is published on the Pharmacy Podcast Network. Thanks so much for listening. And always remember, the pharmacist is the hub of healthcare. Pharmacists are the hub of healthcare. I've heard that somewhere before, Ken. Who's the guy that taught me that saying?
Well, I was driving to Dr. Goodman's one day, and I got a flat tire, and it broke the hub of my. You hit one of these potholes on Long Island, it can like send you to the roof. So I called you because I was scheduled to do something. I said it'd be a little bit late. I said, Todd, if you can empower me to do this conversation when I can do it, so I don't feel rushed or whatever, and you set me up on a platform that allowed me to do conversation about the concierge hub. Because I really do believe that even before the pandemic, the pharmacist really is that hub of healthcare. He or she is that medication expert, but more so, they're a disease state expert as well. And yeah, we don't get recognized, but I know how much we do and how much the essential workers that are out there are doing now, even enhanced with the pandemic. So I talked about how the pharmacist is the hub of healthcare. I believe that in my very being, and I believe that the more we talk about it and the more we do it, the further along we will go to provide a status.
I agree. 10,000%. I get excited when I hear you talk about that. I think that's a brilliant lead-in statement for really the mission of what I stand for, and what you've helped me to define better is how that makes sense, how the primary care physician and the surgeon and the specialist and the dentist and and all care providers that execute on a therapy and there's a prescription involved, how it's that up to that pharmacist to hub it all up and ensure that is carried out, and why it makes sense. So I've believed in that since the day you said it.
Well, the business of pharmacy has pushed us to the side of that hub. They've made us a really minute spoke, and it's a broken spoke. And a physician knows the value of a pharmacist. But right now they're thinking, oh, that's just the entity who's bothering me with so many papers that come over my fax machine for refill this and script that and sync that and do this and do that. They're looking at us as an annoyance. How can a pharmacist be an annoyance when he or she can deliver better outcomes, more reimbursement, and just quality measures, and just be part of the care team? And if we can present that with no out-of-pocket expense, who's going to say no? And that's what we've developed.
Exactly. And I appreciate you kind of covering the real meaning of what we mean when we say pharmacists are the hub of healthcare. I do want to talk real quick about the last episode that came out this week and that just posted this morning. And that's from the Pharmacists Association, the Pennsylvania Pharmacists Association, which is my home state association. I was on the board of directors for 2.5 years with Pat Epple, who's the CEO of this organization. She will be retiring this fall, and a new CEO will be coming aboard, which I'm very excited about. But they just put out Beyond the SIG, which is their podcast that they're in partnership with the Health and Human Services of Pennsylvania Division, as well as the University School of Pharmacy, I'm sorry, University of Pittsburgh School of Pharmacy. And their podcast has been just amazing. This one is by co-host and special host, pharmacy student, third-year student at Pitt, Brooke Kalusich, and she is just dynamic. She actually came to Pharmacy Podcast headquarters last week and did an episode in taking over the Gavel and Pestle podcast, which is a show about law and pharmacy. So I got to introduce you to Brooke. Ken, you're going to absolutely love her.
Well, I do already, because first of all, for Pitt, coming out of there, we already have some extraordinary students who are part of our API programs in our academy. And one of the things that you and I spoke about this week when we thought about conversations about partnership. So beyond the SIG with pharmacy students, the students are the next generation. These are the providers who are going to move us forward. So I think that we should collaborate, not just with Pittsburgh, but let's start in your hometown, Todd. Let's do a live event from your facility. You and I didn't discuss this. Sometimes you kick me under the table virtually when I come up with crazy ideas, but this isn't. This isn't. Let's bring Brooke and others in there, socially distant, and do it the right way. But let's talk about how we can create an academia platform for students of pharmacy with Greg Alston, who you know from our academy, the dean. He's got 30 years of experience, the last, 15 or so in academia, to create a platform where we can go way beyond the SIG. Exactly. We can. This is a new program. This is way beyond the SIG. And let's do that. And let's do it. Pick a day, any day that ends with the letter Y, and RxVIP and Care One will be there with our resources and our people. And we have 220 happy students, Todd, who've gone through the academy just since we opened our doors in April. That's crazy. That's right. Crazy.
Yes. So they did an episode with Dr. Nicole Pizzino, who is assistant professor in the Department of Pharmacy Practice and director of community outreach with Wilkes University Nesbitt School of Pharmacy, which is closer to your side of the United States. It's over on the east side of Pennsylvania. Do you know anybody from Wilkes University, Ken?
How about I tell you that Nicole and I have had deep dive conversations, because she is a diabetic expert. Nicole, I call her when I put someone in my phone directory. I didn't know whether she had 2 Z's or 1 Z, so I put her as Nicole Diabetes. And when she shows up on my phone, she comes up. And I called her. You know, I think she's got 2 children now. And she is the community outreach preceptor and mentor for people from Wilkes-Barre. And when the pandemic hit, we opened up our doors, as you know, to all universities, and we have tremendous student support and have had probably about 24 Wilkes-Barre students. I'll call out for Kayla Masters, who is also going to be one of our leaders down at Wilkes-Barre. We just spoke as recently as last night. This is an individual who applied for a residency and didn't get her dream. Well, we want to make that dream come true by giving her the clinical pathway that she deserves. Look at all the pharmacists who are now applying for residency, and we support that. But it's so sad when they're not going to be able to get their dreams. And we want to be those dream makers. So we have those pathways, those clinical. We don't have PG1, PG2. We're PGU. We're PG for you, the PharmD student, to give you the opportunity to go down a pathway. But bring Nicole in. Bring her on as a guest. She's an amazing care provider, period.
So let's talk about diabetes, Ken. And the reason why I want to talk about this is because you have taken such an important attention for this specific disease state and how pharmacists can impact it. But more importantly, the way that the chronic diseases that are out there, especially diabetes, kind of make everything else swirl into a frenzy, and people end up dying. So kind of share with us, the focus that that pharmacists should have on diabetes.
Well, I think our world needs to have a focus on diabetes. It's not just the pharmacist. It's a horrific disease. We're not going to talk about numbers because I think every listener or everyone has someone in their family or friends who is struggling with this condition. It's a condition that doesn't kill you by its word diabetes. What ultimately causes you to lose your life is the inability to manage that condition. So when we opened up the academy, I had to give content to our students who were coming from all these universities. So I thought about what was important to me, and I made it personal. Sadly, my brother passed away. He was a diabetic, a juvenile diabetic, and I lost him about 25 years ago. And as you know, I left the pharmacy industry for 27 years. And when I came back to get my license renewed, I did continuing education in diabetes because I didn't feel I was there for my brother. It's a disease that gives a certain amount of, there's a stigma to it. I didn't want to catch what he had. This is my own brother. I didn't like the fact that he gave himself injections every day. And it's one of the reasons why when I was a CVS pharmacist and they told me I had to give immunizations, I said, I don't want to. I don't want to, and I didn't. I was one of 2 pharmacists in the entire region who refused to do immunizations. And that was before they then could say, I'll fire you. I said, okay, then fire me. Okay, but then, anyway, well, different story.
Right.
But the point of diabetes is that we can help. And by simplifying it, by connecting it through a technology that Diasys, a company that was born in Atlanta through Emory institutions and clinical research, the technology and the partnership that we have now with them is game changing, just like you said, CE impact. This is the ability for a pharmacist or a pharmacy intern under the direction of a pharmacist, almost like a virtual store, to monitor 24/7 the blood glucose levels and the medication titrations on a dashboard that is absolutely the easiest thing, even for an old guy like me, to manage. So without talking about, things that they don't understand, at your convenience, we're going to invite every listener for RxFusion.live to come on to another event that we'll schedule ongoing. We'll pick a day and we'll have a diabetes care day. Okay, and anyone who wants to learn about how they can make a difference and earn more revenue reimbursements than they'll ever make as a retail pharmacist by taking care of the diabetic patients, I will invite you with my partner, my dia buddy, Caitlin Grenier, who's an adult onset diabetic, who's the success manager for Diasys. And she will be a guest and she will be a co-host with me on a dia buddy show that we're going to be doing, because it's so critical that we help the diabetic patient.
So tell me about the cascade of issues that a diabetic has that's not paying attention to this. Take me in stages as a layperson, but then when you start talking about these next conditions, make reference for a pharmacist listening in where they can impact most based on that specialty.
Well, this is a disease that basically is in 2 areas. Either you do not have no ability to create insulin, or your body isn't allowing you to uptake it to the degree that you need. So you need to supplement that and manage your blood glucose level. But the things that occur after affect your eyes, your feet, the nerves, your kidneys, and of course, major impact on the overall cardiac health that you would have. So the people who sadly lose their life are people who then the comorbidities of hypertension, of hyperlipidemia, of cardiac issues, and of course, some of the physical challenges. My brother sadly had to have toes amputated because of the peripheral nerve damages that are caused. So we need to go outreach right now to connect, to sync up. This is more than what a retailer does to sync up your prescriptions. We have to, and we will, and are putting a pharmacist in the box of every glucose monitoring that a patient could need. And I want to do a call out for iGlucose, which is one of the brands that we will be promoting through our diabetic program, because it is cellular enabled, Todd, which means you don't need a smartphone, because so many people are elderly who are diabetic. But we want to make it easy for them. So the eye glucose monitor, which will be covered with no cost out of pocket to a patient through the Medicare outreach program and the remote patient monitoring program that we offer, along with their supplies, is something that gives real-time management, and you don't have to do a log. It's already put up into the cloud and can be viewed by a pharmacist. And the other thing about a call-out, Todd, is continuous glucose monitoring. You see things like the Libra come out. There's going to be a great product called Dexcom, the G6, which is a continuous glucose monitoring product. What that does is that's no finger sticks. You don't have to prick your skin. I can't tell you how many patients who came into Dr. Goodman's office who were diabetic. I remember one wonderful woman who came in and her fingertips were like she had worked in construction for 20 years. And I said to her husband, let us get her this Libra product from Freestyle. And he said, of course. And of course, it wasn't covered by insurance because it was early on. But you know what, Todd? After that, I called Joe, my pharmacist friend. I asked him before the show, I said, Joe, is Libra covered by Medicare? And she said, no. Is it covered by commercials? Well, maybe one or two. So people have to pay out of pocket. That's horrible. We can provide through our diabetic program that product to a patient with no out-of-pocket expense because of the remote patient monitoring codes that can be delivered, not at a pharmacy, Todd, at collaborative relationship with a physician. That's what the concierge approach is all about. So that's what we're doing.
That's terrific. So I want to jump into to news before we get to our next segment. We do have a special guest today that's going to be amazing to talk with. Dr. Christina Madison will be on the show here at 1:45 p.m. Eastern Time. She's known as the public health pharmacist. I can't wait to hear you and Christina talking and me to be the fly on the wall, Ken.
Love to. I've not had the pleasure of meeting her. I look forward to it.
Awesome. We're going to hear we're going to hear about our news now. So something came out written by Sarah Karlovich. She's the editor.
Hello.
Yes, Karlovich. So she's the assistant editor over at Pharmacy Times. It was T cells may protect vulnerable patients from COVID-19. T cells taken from the blood of patients who recovered from coronavirus can help protect other vulnerable patients from infection, according to a study published in a magazine called Blood. Obviously, we know 1.1 million deaths from COVID-19, more than 42.7 million confirmed cases worldwide. And that's interesting. T cells given to others for immunity and reinforcing what they know about this disease, or I'm sorry, this virus so far. Ken, you're the pharmacist on the show. Let's talk about that.
Well, there are a lot of questions coming up about how creating immunities and ways to do it. Like one of the studies that was being done was actually curtailed by putting antibodies into an individual to see that it would stop the reoccurrence of the coronavirus. I mean, some people in the political sector think that they're immune for life. I don't know. We don't know. And I like the idea that clinical studies, we are a big supporter of clinical studies because that's the only way you grow, both in the pharmaceutical industry and both in terms of clinical trials. We're involved with one right now with a doctor here on Long Island who is doing a CBD-infused mouthwash that when used just as a rinse 3 times a day, can reduce the uptake and the symptoms of coronavirus. I think the key, Todd, is going to be to symptomatic relief for coronavirus. Yes, we're going to get the vaccine whenever. Yes, we're going to have a lot of people get sick, and sadly, more people die. But people die from the flu as well, and it's not a but. Every loss is horrific. I think we need to get to the point, like we are today, where you can look down the aisle at a retail pharmacy, like you can see all the cold medications, all the symptomatic medications. This is an ongoing disease. It's come back. It's going to be back next year. It's going to be back the year after, the year after, the year after. We have to have the forward-thinking solutions for symptomatic so people don't die from this. and have the medical profession with remdesivir and other drugs that will be developed to treat those people who are at a higher level of need.
You know, we're going to dig into that because we're going to have COVID-19 Now session. That's going to be called COVID-19 Now, and I think that's going to be in 2 weeks. We're going to let the audience know through the Pharmacy Podcast Network, but it's going to be a collective insight into moving forward as a nation and how pharmacists will impact COVID-19. I think that is very important, and it is Pharmacist Month. So we have 2 days left in here in October where it's Pharmacist Month. There was an announcement made, Pharmacy Times and the National Healthcare Association, to produce an inaugural pharmacy technician supplement magazine. And the NHA group is members of the Pharmacy Podcast Network. They do the OnScript podcast, which is dedicated to pharmacy technicians. I'm so proud of what NHA does for pharmacy technicians, Ken, and the team, Jeremy Sasser and Jessica, Langley, she and he are amazing hosts. They're amazing providers of not only education to pharmacy technicians, but they put together a new coalition that the Pharmacy Podcast Network is a part of, in partnership with Albertsons, Walmart Pharmacy, the NCPA, Walgreens, and Kroger's pharmacies, called the Coalition for the Advancement of Pharmacy Technician Practice. And we're proud to be hosted and to be members of this coalition with them, Ken. And you've been part of the network for some time, and I know you know those guys over there.
I love those guys. I don't know them, and I think what they're doing is great, because as a retail pharmacist, I recognize every single day I put the key in the door that I could not do my job without the technicians and without the hard work and the extraordinary effort that they put into patient care. I would be happy to support that coalition with you and bring me involved, because what we're doing from a compensation standpoint, Todd, is very innovative in the pharmacy profession. It used to bother me on one hand that the retailers who I work for, the retailer that I work for, would not even give the technician enough to live on, let alone they were making less than McDonald's, in those days when I was there. They probably still are. And it bothered me that the ratio of what a pharmacist would earn, and well-deserved, didn't have a good relationship to what a technician should earn. So the Care One Concierge model going forward is for technicians and interns to be partners with the pharmacist. And we're building virtual pharmacies. Dr. Crystal Cruz and I have had some and Dr. Jason Cavallino, who you know, have had some deep dive conversations about how we can create a culture of partnership within that effort. So a PharmD intern or technician is really, a partner is 50-50. So if we're going to make $1, on a reimbursement, they should make 50 cents on that. Right. And I believe that in my heart, that will bring a better culture to patient-centric care. And we would offer all of the technicians and interns and people who go through the training and the certification with Jeremy and his team, which is a great program. We would offer to hire those individuals and give them a better pathway for earning and for learning how to be a care provider.
Absolutely. I do want to give a shout out. Thank you so much for making this evolution of the Pharmacy Podcast Network possible to the RxSafe team. They are sponsors of the RxFusion.live program. And I'm just excited about what they're doing for medication adherence, as well as what they're doing for patient care and supporting pharmacists through education and technology and how to leverage adherence packaging. We're going to have them on live, Ken, at some point so we can dig into this. But our next segment of the RX Fusion is with the one and only Dr. Christina Madison. Dr. Christina Madison is known as the public health pharmacist, and she believes, just like Ken and I, that you have to prioritize pharmacists in public health. I'm excited about this opportunity to really kind of build upon the conversation and having someone come in that's also a pharmacist like you, Ken, so that you guys can talk and can share. So I want to welcome the one and only Christina Madison to the RxFusion.live. Welcome, Christina. Hi,
Thank you so much for having me.
very welcome.
Good afternoon. How are you,
Uh,
Dr. Madison? Nice to
I'm
meet you.
awesome. Nice to meet you as well. So, I'm actually at my co-working space right now, which is pretty awesome. So, I can't be more thrilled about just everything that's going on right now with the presence of pharmacy and pharmacists really being at the forefront of media and how that's impacting the profession as a whole, but also communities, because I think now we're being seen as this critical access point that at one point I think was kind of overlooked. I often say that unfortunately pharmacists are kind of the black sheep of the healthcare profession because we do all the work, but then we don't get a lot of the attention and praise. I think that's well deserved.
That makes me the black sheep's greatest fan. So
I know, right? Who doesn't love an underdog?
But think of all the good things that sheeps do. Sheeps provide warmth. They provide, they give up their skin and their fur so that other people can be warm and taken care of. And I really appreciate you joining us today for a number of reasons, because public health is at the forefront of our world, sadly, with the pandemic. But also more so, I'm looking at you and I'm looking at their backdrop, and now offline I can tell that I need the TV and I need the backdrop so it just doesn't show the picture over here of the New York City skyline, which nobody can see. Or you can't really see in the corner there because I don't have a movable camera. That's my grandson Max's first art picture that doesn't go on a refrigerator, it goes on the back of my door. But welcome, and I love what you're doing because public health really is so critically important right now.
Yeah, right after this, I'm actually going to get interviewed by one of our local TV stations about, Halloween and, COVID precautions and everything related to, that. I live in Las Vegas. And so Halloween traditionally is a really big thing here. Like people celebrate Halloween for like the full week prior, and people have lots of house parties and there's lots of like trunk or treats and lots of activity during this time of year. It's also Nevada Day is today. And so as a state, we just celebrate a lot. And so I think there's a lot of consternation around, do I go to house parties? Do I engage in trick-or-treating with my children? Is it actually safe? And unfortunately right now, because we have seen a rise in cases across the country, that really isn't something that, that as a public health professional, we're recommending right now. So that'll be an interesting story. That'll be probably for our 5 and 6 o'clock news.
Well, why don't you tell them that, and I like to come up with ideas that on the spur of the moment. My granddaughter asked me this morning what I was dressing up for Halloween, because she's dressing up as, of course, Elsa from Frozen, and the little one is going to be a bumblebee, because I call her Hannah Bee. She's a little bumblebee. And they said, my daughter said, well, what are you going to do? Well, we're not going anywhere. We're not doing anything. And I said, you know what I'd like to do? I'd like to dress up as a pharmacist. I'd like to put that white jacket on. So maybe it's like 1:30, 1:45 on the day before Halloween, but with your power and your voice and our voice and listening to Todd putting us up live, why don't we have every pharmacist and every pharmacist technician dress up for Halloween tomorrow by simply putting on their white coat and being a pharmacist. And let's put that image up all over the industry. Because you know what? I'm proud to be a pharmacist. And if I'm going to dress up and I'm going to show somebody who I am, I'm a pharmacist, true and true. So let's do that, Todd. Put it out on social media. I have 11 friends on Facebook, Christina. So I don't. Okay. So if you follow me, you'll see all the things about my daughters and my grandkids and things like that. But I don't have that social, exposure. But Todd does, and you do, and I'd be happy to follow you anywhere in the vision about public health.
No, I think that's excellent. We should put out a call to have people show up on Halloween as their favorite healthcare hero. And I agree that pharmacists and pharmacy technicians, they're my favorite healthcare heroes. So I think that's a fantastic idea.
And actually, what's this thing about Pharmacist Month and Women of Pharmacists Day? I'm kind of done with that. With 365 days a year, let's make our profession the difference makers. back to the hub. If you're the hub of healthcare, you're turning every day. You're not just doing it in October. I don't think I'm a better pharmacist in October than I was in September or I will be in November. And to be recognized, we are recognized. You know who recognizes? I'm going to lower my voice. The patients recognize us.
Yes.
And you know what? To me, Christina, that's more important, really, than the business of pharmacists who simply don't get it. The business of healthcare does not get the fact that we are truly the healthcare providers that are saving lives.
Yeah, so that's such a unique perspective. I think when you're, obviously we don't, we go into this work because we want to make a difference and we want to make a change. And we're not going into it for the recognition. However, I do think that we are deserving of that recognition. And as a whole, I think our profession just needs a PR makeover, right? Like we need to be able to toot our own horn without like feeling like somehow we're going to be encroaching on some other healthcare professionals, space, right? So, when you think about that recognition and you think about the fact that you really are making such an impact in your patients' lives, that's my why. That's what fills my cup up. That's why I get up in the morning. That's why I do what I do. And, I'll just give you an example. So yesterday I was providing flu shots at our local gay and lesbian center. And there happened to be, a client there who came in for their flu shot, and they kind of hung around and they were, sort of talking with me, and they had, came back and forth into the room that I was in. And I kind of got that vibe that maybe they wanted to talk with me a little bit more. And so, after engaging in conversation, come to find out, this person, was really in need of not just a flu shot, but they needed help finding resources for food and housing, and came to turn out that they didn't really have a great relationship with their parents, and they were kind of in between housing. And so, for me, like I started with the flu shot, but then I was able to help that person get food and potentially a lead on some stable housing and how to maybe try to find a job because they were recently, they'd recently moved here. And so that to me, like that just made my whole day, knowing that that person felt, first of all, comfortable enough to disclose that to me. And when I asked the question, are you getting enough to eat? They felt comfortable enough to respond, so that's public health to me in a nutshell, right?
I agree. And what we did because of the pandemic, we rebranded and pivoted our company. RxVIP Concierge was waiting for that patient to come to us. But now we didn't have to do outreach. So Care One Concierge, that one patient who you made a difference in his or her life is really what we are all about. So we pivoted to be very proactive, and we teach care and compassion to call people, and we use COVID-19 at-home testing is that door opener, because the flu shot you can't do via telehealth, sadly, even though CVS is working on doing it. We're working on it.
There might be something coming.
I know. I was going to share that with you too. I know a little bit about. I'm like farmers insurance. I know a thing or two because I've seen it. But yes, it's happening and it will. But the point I'm making is that this outreach to establish a relationship is what healthcare and a pharmacist can do that if they have the time and are not flipping burgers at CVS Pharmacy and looking at the numbers that their supervisor comes in to tell them either you do those numbers or you're going to fire you and replace you with somebody cheaper and who's going to listen to us. So I listened to them, but it went in one ear and out the other because I always focused on the patient. That's why I was a Paragon winner 2 years in a row and an emerging leader. I didn't change who I was. They wanted us to change. I wouldn't change.
No, that's fantastic. And, not to kind of like bring up sort of, our challenges right now that we're having with communities of color, but I do want to really, emphasize that, a lot of the, racial tensions that we're seeing right now were always there. They were underlying, but the pandemic has just basically shown, and please forgive me if this is crude, a giant black light on the sheets. You know, it's like showing all this stuff that was there, that we knew was there, and all these, you know, these disparities. But, you know, it goes back to that thought process that you had earlier about that relationship and having that established relationship. And when you don't have that established relationship in communities of color, it really makes them feel like you're coming in and you're saying, oh, we want to help you. But in their eyes, if you don't really establish that long lasting connection, they just think you're coming in to do safari research. Like, here, I'm coming in, I'm going to see what you're doing, and then I'm going to take all your data, and then I'm going to leave you with the same problem that you had. Right. And so you gotta really believe in making those lasting connections and making the community feel like you have skin in the game and that you have a vested interest in them actually having, you know, improved health outcomes. So, you know, I know that when I go out into the community in these places that ordinarily wouldn't have somebody go there, they're more likely to take my recommendation because I look and sound like them. And I never take that for granted. And I want more people to feel empowered to go and do these kinds of things, because that's what we need. We need people to have skin in the game, to have relationships in these communities so that we can build healthier, you know, healthier communities and healthier lives.
You and I went to different schools together because that's exactly what we created, and the vision and the mission of the DiaBuddy Club. I believe that diabetes sadly affects a community that needs to be served in your communities. And it doesn't matter about what the color is, but if you need the help financially, or if you're in an area that you don't get the literacy, or if you don't get the education, our skin in the game is to put the entire universities and colleges of pharmacy that we mentor in there, and their APPIs, which are brilliant, they're articulate, they care, they haven't been burnt out by the business of pharmacy, to do outreach to patients in communities just exactly like you're talking about, to offer no cost diabetic monitoring, no cost supplies and things like that, and to help them. And Chun Young, who's the CEO of Diasys, he and I talk every Sunday at 2:00 about how we can do exactly what you just said. And I would love to have you come in to our DiaBuddy Club as one of our charter members, so that we can reach more communities that you are already reaching, with the goal of total population health, because it's total, it's inclusive. It cannot be we do it for you, but we don't do it for someone else. So I didn't expect to have found another DiaBuddy, you know, in our club today, Todd, so thank you. This is a wonderful club. We'll introduce you to Caitlin Grenier, who is my DiaBuddy success partner in this initiative, which is dear to my heart. If you would have listened earlier, my brother passed away from diabetes 25 years ago. So this isn't about the business of doing this. This is about the passion that we need to have, because diabetic patients and patients with chronic diseases that are caused by diabetes are going to die. There'll be more that die as a result of being negative to COVID-19 than sadly the hundreds of thousands who have died by being positive. We need to help, and I'm on your team.
Yeah, absolutely. I mean, there's all kinds of, you know, issues associated with this that will ripple through our healthcare system for years to come. You know, I think it's really interesting. I hear a lot of people say, oh, I can't wait for 2020 to be over. But in my brain, I'm thinking, what guarantee did you get that 2021 is going to be better?
Yeah.
Right.
Like, when did that memo come out and I missed it? Right? Like, what?
The ball is not dropping down to end this at all on New Year's Eve. No. Wow.
It's hilarious to me, but I think, you know, so it all stems from, you know, the experience, the lived human experience, which is that we are, in all senses of the word, hopeful beings.
Yep.
And so because we have this hope, we were all hopeful that it's going to be better. And I think that's what we really need. We need that beacon of light and hope to be able to get through this and to be able to get through it together. And I think pharmacists are that beacon of hope.
And Todd's going to cut us off soon because we're coming to the end. But this is just the first dialogue with a quick call out. We have a partner in Newswire who's a great partner for us, Joe Esposito, the president. I want your voice to be part of our voice, and we'll share it across the country together. So have your people call my people.
Sounds awesome.
You, Dr. Christina Madison, you can find her at The Public Health Pharmacist. We were excited to have you on. You got to come back. You got to